Let us look at anti-snake venom. We look at indications, administration, and how it is dosed. Indications for anti-snake venom. Anti-snake venom, ASV, is given only to patients who show signs and symptoms of systemic envenomation. Signs and symptoms of systemic envenomation. You can have neurological signs, which include paralysis, photophobia, seizures, among others. You can have hematological abnormalities, whereby the patient will have low platelets. You can have cardiovascular signs, such as shock, hypotension, blood pressure changes, cardiac arrest, among others. And in severe local envenomation, you can have progressive swelling and tissue necrosis. When you take the samples to the lab, the laboratory findings will be as follows. You'll have abnormal clotting profiles, elevated enzymes, or other relevant markers based on the snake species involved. At administration of ASV, and we start by looking at the route of administration. Intravenous infusion route is the most preferred because it reduces the risk of acute hypersensitivity reactions. Though you can still use IV slow push, that is only if it is necessary, maybe in emergency cases. Intramuscular route is not recommended because of poor absorption. At how to prepare and infuse ASV. And we start by looking at reconstitution. And we can say that the ASV mostly contains lyophilized powder that requires reconstitution. So the fluids that you can actually use include normal saline, that is the isotonic solution, 0.9% sodium chloride solution. And that one is the most preferred. If it is not there, you can use dextrose 5% in water. Ringer's lactate is not preferred because it may cause precipitation of proteins in some antivenom preparations. Some lyophilized ASVs require reconstitution with sterile water for injection before dilution. So it is always important that you look at the manufacturer's instructions for volume. So when it comes to dilution, ASV is typically diluted in 100 to 500 ml of normal saline. You can also use higher volumes, that is 500 to 1 liter. And this may be used for slow infusion over 1 hour. When it comes to infusion rates, you should administer ASV slowly over 30 to 60 minutes to monitor anaphylaxis. Slower infusion may be used if the patient is at a higher risk of getting allergic reactions. And if you are using a slow IV push, you should give it over 10 to 20 minutes under close observation. Then we look at premedication and monitoring. In some settings, not all, premedication with subcutaneous epinephrine or an antihistamine may be considered, though this practice varies from one setting to the other. Then you should always observe for anaphylactic reactions such as itching, rashes, and difficulty in breathing. And because of that, always ensure that you keep adrenaline, antihistamines, and steroids ready to counter the allergic reactions. Then you should always monitor the vitals every 15 minutes for the first 1 hour. Calculation of the dose of ASV. The dose to be administered depends on the snake species, severity of envenomation, and the response to treatment. So when there is mild envenomation, which is characterized by local swelling but no systemic signs, then there is no need of administering ASV. But when there is moderate envenomation and severe envenomation, then you need to administer anti-snake venom. So is it important for you to repeat dosing? So after the initial dose has been administered to the patient, it is important that you reassess the patient's clinical status, and if systemic or severe local signs persist or worsen, then additional doses may be required. So the repeat doses are typically administered at intervals, let's say after 1 or 2 hours, or as per local protocols. Some protocols say after 6 hours. And this is based on the ongoing symptoms and laboratory results. And you should continue dosing every 6 hours if bleeding, paralysis, or coagulopathy persists. What about the maximum number of vials to be administered? There is no strict maximum dose. Why? Because even higher doses have been used successfully. Let's say up to 30 vials. But now sometimes when you go up to 50 vials and you realize that the patient is not responding, maybe you could be using the wrong type of ASV. So you need to look at that among other reasons. Management of ASV reactions. Anti-snake venom can cause allergic reactions, which include the early reactions that occur within minutes to hours, and that is anaphylaxis. And if this occurs, you give adrenaline or epinephrine, that is 0.5 milligrams IM for adults. And then for children, you give 0.01 milligrams per kg body weight. You can also administer antihistamines and also steroids. And then for late serum sickness that occurs 5 to 14 days later, this one is characterized by fever, rash, and even joint pain, and you can treat it using antihistamines and steroids. So, are there any special considerations? When it comes to children, the dosing is the same as that of adults. That is based on the venom and not body weight. And then when it comes to pregnancy, ASV is safe, so you treat the envenomation aggressively. Then when it comes to the types of ASVs that you have, polyvalent versus monovalent ASV. For polyvalent ASV, that one covers multiple snake species, which are common in Africa and India. But for the monovalent ASV, that one is specific to one snake, and it is used in some regions. When to stop ASV? You stop ASV when systemic signs resolve. These include neurological recovery and also when there is normal coagulation tests. There is no need for repeated doses once symptoms improve. Thank you.